The federal government has unveiled its expanded dental care program, and eventually about 9 million Canadians who don't have private dental insurance could be eligible for coverage. It's a $13 billion initiative, and it will unfold in phases. Dental care is a key part of the Liberals' supply and confidence deal with the NDP. So let's bring back Evan Dyer. Busy day for you, Evan, in Ottawa. Tell us about the rollout.
Well, it's a huge program, as you say. I mean, you're talking about eventually enrolling 9 million people at the rate of about 250,000 a week. So coverage doesn't actually begin until June of next year, but they're looking to start enrolling people almost right away with the first call center opening on Monday. Let's listen to a few Liberal and one NDP politician discussing the scale of this program, Anna.
This is the largest public benefit rollout of any program of any government in Canadian history.
Look, this is a proud moment, I think, for all Canadians.
This is the biggest expansion of public health care in Canada in many generations.
The biggest expansion in many generations. And of course, we saw one of those people there being an NDP health critic, not a member of the Liberal Party government. And the reason for that is because there are two parties claiming credit for this program today, one being the Liberal government, but of course its junior partner in the supply arrangement that allows it to operate as a minority government is the NDP. And the NDP's price for that arrangement was this dental care plan. So the NDP is telling its voters, look, this really would not exist unless we had twisted the Liberals' arms into doing this. Now they may be trying to make it their own and claim it as a Liberal program, but really this was us. And we saw Jagmeet Singh come out earlier today and make that very point. Let's watch him.
Pierre Poilievre, despite having taxpayer-funded dental care for most of his adult life, voted against kids getting dental care. We've used our power while in this minority government to give people help, while Pierre Poilievre has used his power to make it clear his intentions to cut the programs that people need.
So there he was taking a shot at Pierre Poilievre for opposing dental care, but also very keen to make the point that the Liberals had to be sort of dragged to this point, according to the NDP. So let's just talk about how people can apply. People will receive letters in the mail, and then they can call a number and answer a few questions to get enrolled. Eventually, that phone system will be replaced around May of next year with online applications. But you'll be invited to join based on your last tax filing, and that's because there is a cutoff for households that make more than $90,000 a year. They will not be eligible for this program in any way. And there's a sort of a sliding scale of copays for people who are below $90,000 per year but above $70,000. So let's say that your household income falls in the $70,000 to $80,000 bracket. You'll be expected to pick up 40% of the cost of any dental treatment. If you're between $80,000 and $90,000 a year in your household, your copay goes up to 60%, and the government will only be picking up the 40% share in that case. It's only for people who are under $70,000 per year in their household that this program is truly free, but it does cover the bulk of dental treatments that people would need in the ordinary course of things, including cleaning, polishing, examinations, x-rays, fillings, root canal treatments, dentures, and all those other fun procedures that we all have paid so much money for over the years.
Yeah, exactly. This is a really big program, billions of dollars. What are some potential problems the government could encounter as it rolls out?
Well, I mean, the government is saying actually that although it is a very expensive program and it's going to cost about $4.4 billion per year estimated to administer, they are saying that they do hope to see some savings in other areas of healthcare. The idea here being that the ounce of prevention prevents a pound of cure, because we do know that dental care issues are often linked to other more severe healthcare issues. I mean, there's a well-known link, for example, between gum disease and heart disease. And so the existing healthcare system often does end up dealing with these problems further down the road in a more expensive way. That's the point that was made by Health Minister Mark Holland. Let's actually watch what he had to say about that.
The costs that are avoided, and let me just give you an example. When I'm talking to oral health care professionals who are devastated by the fact that they're seeing people who, because they don't have access to care, wait until that becomes an enormous crisis in their health and they go into a hospital. The cost of that care is huge. The cost of lost productivity and employment is huge. As a society, we need to start looking at the investments we make now, not only as a matter of social justice, but as a matter of productivity.
So, I mean, that's one of the proposed benefits of this, or one of the argued benefits of this. But of course, when you throw 9 million new people into a system like Canada's existing dental care system, one of the questions that people will be asking is, are there enough dentists? And of course, are these patients just the same as the other existing patients, or are these people who have deferred needs, people who, because they haven't been able to go to the dentist, may suddenly appear in the system with all kinds of delayed problems that will require more sophisticated dental work. So that's one of the questions that remains to be answered. Will there be enough dental professionals? I should also mention there is a patchwork of dental plans already in Canada. 4 provinces and 2 territories have very different plans. Some of them help children, for example, and the federal government has asked those provinces and territories to maintain those systems so that this can operate on top of those, but the provinces and territories haven't committed to do so. So if they were to take away the existing programs that exist and let the federal government just sort of step in and fill that void, then the cost might potentially be driven even higher than that $4.4 billion a year.
Lots to watch for. Evan Dyer, thank you for explaining it all.